Hi, good morning, folks. Almost good afternoon. Welcome to a webinar being hosted by the Public Health Institute of Western Mass. My name is Andrea Freeman. I'm the Policy Director with the Public Health Institute, and we're thrilled to have you join us today. We're focusing on it's Second Chance Month, and it's also National Public Health Week, and perfect time for us to talk about clean slate laws and how it interconnects with public health. We've got a uh, great group of presenters today for you. I just want to cover a couple quick housekeeping things while more people are joining on. I see the number growing here. First of all, you probably noticed we are recording this webinar. Also, anybody registered, whether you participate or if you're able to join in or not, we will email a link to the video and any resources that are shared in the chat today. If you'd like to see the show captions, you can click on the captions button on your screen and you'll get automatically generated closed captioning to be able to read on your screen. We will have time, we'll have time for questions and answers, and we invite you to post them in the Q&A portion at the bottom of your screen, the Q&A section if you have questions, rather than risking them getting kind of lost in the chat. But we will do our best to keep an eye on the chat as well. And then lastly, before you sign off, we'd love it if you did a really quick survey to let us know what you thought of this webinar. It's totally anonymous, don't be shy, but whenever you click off, you will get an automatic survey to share your thoughts. And with that, I am excited to just give you introduce you to the four panelists that we have coming. And starting off first, I'm starting out with the Executive Director of the Public Health Institute of Western Mass, Jessica Collins. She's a Massachusetts native. She's been on the board of the South Hadley Board of Health. She's been the chair of the Mass Public Health Association. That's really when I first got a chance to work with her. She's also been at Business West, named her a woman of impact, and something she won't tell you because she's very modest, but she just last week was received an award from the Urban League of Springfield for their Inclusion Luminary Award. So we're very proud of her for that. And then next, boy, Dr. Sheena Mead. I don't have, there's no way I can tell you everything about her. I'm so glad to have her here today. She is the Chief Executive Officer and founder of the Clean Slate Initiative, or CSI. And I first came in contact, or I first had a glimpse of Sheena Mead with her TED Talk a few years ago. And for sure, she had me at hello. And I'm just so proud to be working with her staff on the Clean Slate Massachusetts Coalition. Previously, she was the organizing director for the Florida Rights Restoration Coalition. And P.S., it was nominated for a Nobel Peace Prize. I don't think I've ever been able to say that before. She's on the board of the Policing Project at New York University School of Law. She's worked with Lady Gaga. She's worked with Ariana Grande. I mean, I could go on, but the really important things is what she'll be telling you here today. And I'm so glad to have this national leader. And then next, you'll hear from Senator Adam Gomez, and he is a state senator here in Springfield. Springfield native, is the first Latino to serve in the Senate from this Hampden district, Hampden County here, which is where Springfield is based. Previously, he was a Springfield city councilor. He's currently he currently chairs the Joint Committee of Community Development and Small Businesses in the state legislature, and is also the chair of the Committee on Cannabis Policy in the state legislature. And again, so much more I could tell you about him, but we will it's more important to hear from him. And then last but not least, Jay Ash is joining us. He is the CEO of the Mass Competitive Partnership. Some of you may recognize him. He used to be the Secretary of Housing and Economic Development under Governor Charlie Baker. Before that, he was the city manager for the city of Chelsea, just north of Boston there, where he grew up. And thrilled to have him here today as well. And with that, I'm going to turn it over to Jessica.
Great. Thank you so much, Andrea, and thanks to everyone for joining us today. So what is public health and why do CORI ceilings matter? Well, public health considers both individual and community health. Public health focuses on the air we breathe, the food we eat, what we watch on screens, the daily routines we teach our children. It is the promotion of positive systems, policies, and behaviors with the goal of preventing disease and injury. We consider the Clean Slate initiative a public health strategy, advancing policies that will automatically clear eligible records for people who have completed their sentence and remain crime-free, and expands who is eligible. This strategy is a quintessential public health example because, next slide, please. Our public health concern is that criminal records create barriers to accessing fundamental basic human needs, which grounds a person's ability to cope with adversity, as well as the ability to capitalize on other life-giving opportunities and resources that are essential for good health. A few years ago, our Live Well Springfield Age-Friendly Coalition heard from some older residents that their record was impacting their ability to access housing. We listened to those men's stories and worked with them on a health impact assessment, looking at housing providers' practices and policies using criminal background checks for housing decisions for older adults. Here's what we learned. Historic and current policies of mass incarceration in this country have led to many more people with records who are disproportionately Black and Latino. Research shows that each year spent in prison corresponds with a 2-year reduction in life expectancy, and any involvement with the system has dramatic effects on mental and physical health. A report from our local Hampden County Sheriff's Department found that 40 to 55% of people released from that jail have unstable housing plans. And people with records are at high risk for unstable housing, homelessness, and further involvement in the criminal legal system. The health impact assessment also highlighted for older adults that there was no evidence that having a criminal record impacts their success as a tenant. We did not find any evidence that older people with criminal backgrounds are more likely than other residents of public housing to commit crimes. And again, the research shows unequivocally that not being able to access affordable housing can affect mental and physical health and impacts the individual, their family, and their community. Imagine if we assessed every single basic human need like we did for housing and how having a record impacts each need. That is why the Clean Slate initiative is so important. And I am thrilled to introduce the best speaker on this critical issue's behalf, Dr. Sheena Mead.
Thank you so much, Jessica. I appreciate you. Hello, everyone. Jessica was just talking about imagine. And so actually, I want you to take a moment and to go down my personal journey. So just imagine this. You made a mistake in your early 20s. Many years have passed, and you turn your life around. You work hard at your job. You're a good parent. You take time to help your family and neighbors in times of need. You're a community activist. But yet that record is still following you. Not just as you seek new opportunities to move up a career ladder or look for a home that meets the needs of your growing family, but it's a stress, emotional and mental stress that you carry every day. That stress helps shape how you see others and how you see yourself, and it's unhealthy. And no matter how much you grow as a person, it never seems to leave. Can you imagine what it feels like if that weight is lifted? So the scenario I just shared with you is pretty common experience, incredibly common when you consider that 1 in 3 adults in America have experiences like this. including about 1 out of 5 adults in Massachusetts. But for many, the challenges can be far greater than that scenario that we just walked through. And I look forward to talking more about how an old arrest or a conviction record can greatly impact public health and the opportunities we have to improve the well-being around us. I want to first thank Jessica and the entire team at the Public Health Institute of Western Mass for hosting this very important conversation, for being a valuable partner in the Clean Slate Massachusetts Coalition. And because of the coalition's work and the commitment of legislative champions like Senator Gomez, who were joined today, Senator Friedman, Representative Keith Vargas, and Brandy Fluker-Reed, and all of the lawmakers who are the petitioners on the Massachusetts proposed Clean Slate legislation. I'm looking forward, and I'm celebrating actually happy Second Chance Month. April is Second Chance Month, as many may know. But I'm excited to know that Massachusetts is on the path to become the next state to pass Clean Slate legislation. Yeah, let's clap and celebrate. I'm looking forward to being the 13th state that has enacted the policy. And Clean Slate policies help ensure that people can earn a meaningful second chance after taking responsibility for a past mistake. So I really like to just break down what we're actually talking about when we say clean slate laws and what they really do. So nearly every state across the country has a process to seal certain arrest and conviction records after an amount of time has passed and people have met requirements, which includes remaining crime-free. Sealing a past record is an important step in the rehabilitation process. It's important that people have a fair chance to build a better lives for themselves and their families once they have paid for their mistakes. Unfortunately, less than 10% of people who are eligible have their records sealed. That means that the important step of rehabilitation is out of reach for over 90% of people who have a past arrest or conviction. And let me really put that in perspective. There's 70 to 100 million people in the United States that have some sort of an arrest or conviction. 30 million of those people are eligible today to get the records clear. Let that just sit with you for a moment. 30 million people today are eligible. But less than 10% of those people actually try to get the record sealed. And the reason why, you may say, well, why? Well, the process can be expensive. It's covered in a lot of red tape. Sometimes it requires a lawyer taking time off to attend hearings after already meeting the requirements. And that goes back to that mental and emotional stress that I talked about. Can you just imagine having to chase getting your record cleared after you have already met all the requirements? But the Clean Slate laws can fix that. The states are streamlining the process by developing and rigorously testing software that creates guardrails to ensure eligible offenses are identified, initiate the process of sealing specific records once they become eligible. And as a result, these low-level records no longer appear on background checks and exclude people from opportunities. This ensures that certain public safety employees and law enforcement have access to sealed cases when needed. So in a nutshell, it removes the burden off the person back to the government. So Clean Slate laws ensure people receive a second chance after earning it. On the surface, it may not be clear how Clean Slate connects with public health, but you don't have to dig deep to find out that how deeply they are connected. Our campaign strategist, Caitlin, who some people may know, actually wrote a blog post about this. It'll be published on our website tomorrow, so I'm doing a shameless plug for y'all to go check out our website tomorrow, cleanslateinitiative.org. Be on the lookout. But Caitlin shares how social determinants of health are things that encompass 5 main pillars of a person's life: someone's economic situation, the level of education, the healthcare they have access to, where they live, and who makes up their social circle and wider community. I also want to take a moment for our folks who love data points to offer some data points that demonstrate how a past record impacts each of these pillars. It's not hard for you to see how a past record can impact someone's economic situation when you realize 94% of employers use background checks to screen applicants for a past record. And how a past record can reduce the likelihood of someone getting a callback from an employer is more than 50%. And when you think about people who have an arrest or conviction or maybe formerly incarcerated, when they get out, they try to go back, get their education so they could get skilled up to find a job. Well, even that sometimes is meet with a barrier because 72% of colleges and universities use background checks to screen prospective students. So it's clear how a past record can impact the level of education someone could obtain. And research has shown that every year in prison shortens an individual's life expectancy by 2 years. And that is sourced, and I could drop that source in the chat when we get to Q&A. With 90% of landlords relying on background checks as a past record could determine where people live, that limits options and eliminates opportunities for people to move into safer communities. It is also worth mentioning that when the Public Health Institute of Western Mass implemented a health impact assessment of records on people's ability to secure safe housing, they found that people with a record are 11 times more likely to be homeless. And homelessness has a staggering public health consequence. People experience homelessness, suffer from early mortality, dying as early as 30 years sooner than their housed counterparts. And lastly, a past record can prevent people from fully contributing to their communities, such as volunteering to attend a child's field trip and participate in social events. And for people that may sound a little far-fetched, but I'm here as a person with a lived experience, being denied the opportunity to just engage in one of my children's field trip to a trip to SeaWorld, because all of the paperwork and the background checks I had to endure just to prove that I was worthy to just attend as a chaperone for my child's field trip. So the question isn't whether a past record can impact the social determinants of health. Instead, we need to ask how we can reduce the harm a past record creates while keeping our community safe. And you probably could guess that the CEO of the Clean Slate Initiative would say that Clean Slate is a part of the solution. And you're right. But you don't have to take my word. There's data to back me up. Last fall, CSI commissioned a survey to examine the impact of Clean Slate is having on people who live in the 3 states that the laws have already passed and already start implemented: Pennsylvania, Utah, and Michigan. And we had some really good respondent survey results. So when we asked people who benefited from their state's Clean Slate law, we heard that 42% of respondents reported improvements in employment and personal finances. 35% of people experience improved family relationships, and 34% reported positive mental and self-esteem changes. 24% of the survey respondents reported improving housing access, and 22% experienced increased education access. So we're starting to see that people experience transformational changes in their lives, and we know that over 14 million people are on the pathway to fully cleared records in 12 states that have passed Clean Slate laws. I kind of said that number really quickly, but let me just slow down. Over 14 million people are now on the pathway to fully cleared records in the 12 states where we passed Clean Slate laws. So on the surface, sealing records recognize individual growth, someone moving towards the better version of themselves. But it's just not the individuals who benefit when we seal records. We know that elected officials from both sides of the aisle recognize that Clean Slate laws help families and make the communities safer. And research has found, on average, people who receive record clearance were 11% more likely to be employed, and saw that over 22% increase in income within 1 year of having a record sealed. Also, children's well-being is tethered to their families, who also benefit from parents having an opportunity for better opportunities and economic mobility. And also data shows that 1 out of 2 children have a parent that have an arrest or conviction. 1 out of 2. So again, automating the process frees up resources so the courts and the law enforcement can focus on immediate safety concerns and not waste time on past mistakes that people have already paid for. So in closing, Clean Slate is a public health policy. Clean Slate is public health policy in action. And that's because the two share common values and goals. I have met with many public health officials who do the work to ensure that people have a fair shot at a healthy life. The same could be said about Clean Slate advocates. Helping individuals and communities live more safely is another shared value. So Clean Slate policies combine the value of accountability and opportunity, compassion and efficiency are some of the central tenets that are also associated with public health. Again, that's why I'm grateful to include Clean Slate in this important conversation as we recognize National Public Health Week. And I'm very glad for our partners that are lifting this issue up, because the Clean Slate laws do intersect with a lot of issues. And sometimes people don't really take the time to think about how it impacts the public health sector and public health of an individual. And so I believe that we're capable of continuing the momentum that the Clean Slate has experienced across the country. And again, I'm grateful for the lawmakers, the advocates, the public health professionals working to make Massachusetts the next state to pass Clean Slate legislation as we endeavor to create healthier futures for people and communities across the Bay State. Again, I'm looking forward to any questions and be able to have further conversation.
Great. Thank you so much, Dr. Mead. That was fantastic. And I just want to thank you for your leadership at the national level. I know that you are very, very busy and obviously just having tremendous impact. So thank you so much for joining us. I'm going to turn over to another fantastic leader that we call our own, State Senator Adam Gomez. Thank you for being here, Senator. And we'd love to hear from you now.
Well, thank you so much, Jessica. I want to give a big shout out to Sheena. Thank you for doing all the hard work, spreading this piece of legislation all over the nation. Very proud to sponsor this piece of legislation alongside my partners, Brandy Fruka Reed, and also because there's two parts of the Clean Slate. We have two pieces of legislation going on. So I'm just going to talk a little bit about the one that I have filed, but basically works in conjunction with what myself and Sydney Freeman were able to file on the. I'm also the co-lead on that other piece of legislation as well. I want to thank all of you for gathering here today to discuss a matter that is not only vital to our justice system, but also essential for fostering more inclusive society. We are here to talk about the process of sealing criminal records, a subject that touches many lives and holds the key to unlocking potential for countless individuals. And firstly, let's address the current barriers surrounding the sealing of criminal records. The existing process can be complex and daunting, often leaving individuals feeling overwhelmed and unsure of their rights. Many people don't even realize that they might qualify to have their records sealed. By automating this process for those who meet specific criteria, we can also alleviate an immense burden on individuals. This change will empower them to take charge of their future without being held back by the weight of their past. Furthermore, simplifying the sealing process is not just a matter of convenience. It is a matter of fairness. A streamlined approach in sealing records can bring much needed equity to our justice system. It ensures that everyone, regardless of their socioeconomic status, has equal access to opportunities to rehabilitation and reintegration into society. When we make it easier for individuals to have their records sealed, we are fostering an environment where everyone can thrive. Community advocacy plays a critical role in this journey, though. And I urge each and every one of you to get involved and advocate for reforms that support individuals with incarceration records. It's no secret that I've always been upfront on issues of this magnitude, because I was one at 17 that was charged with a mandatory minimum at 17 years of age. For you guys to participate and support individuals with these records, it's an initiative that promotes awareness and education about these issues. Together, we can create a strong network of support that champions the rights of these seeking a second chance. they're not looking for a handout. They're looking for a hand up. And they deserve the opportunity to rebuild their life. We must stand firm in our belief and the compassion and support of our fundamentals to supporting those who are striving to put food on the table, to put a roof over their head, to they made that mistake, but looking to not live with that burden of it following them day in and day out, and a representation of who they were is not who have they become. Like you, I stand before you as the state senator of the Hampden district, which Hampden County for quite a while has been one of the most arrested counties in the Commonwealth of Massachusetts. And at 17 years of age, I got involved with advocacy with an organization called Neighbor to Neighbor, and we were a part of the 2017 last criminal justice reform bill. And this is a piece of criminal justice reform that needs to be passed today. And myself, I stand before you utilizing the tools that the legislature has been able to put together. And this is another tool that I think that would help our economy thrive and put individuals in the inside of our workforce and be able to support their families and being able to use these tools. I stand before you as a person that felt beaten down, felt that I couldn't get my head above water after a while. And a lot of even some of my colleagues from the past have even asked me, why do you continue talking about the past? And I was like, because if it wasn't for the past, I could not use that to perform and make sure that I'm supporting individuals that have the same background as myself, growing up in the city of Springfield, looking towards a better future. Yes, we make mistakes, but sometimes we just need to get rid of that stigma of that, that one mistake isn't who we are and who we became. So even in certain turning points, even though I stand before you with a clean record now because of some reforms we were able to pass in the legislature, individuals and thousands of other individuals, Black and brown, Asian, and individuals that come from rural and poor communities and urban centers that have been over policed and have been arrested and sometimes overcharged, that these individuals are just looking for that leg up. And I think that right now, Clean Slate is the opportunity for us to move our Commonwealth forward. And I'm happy to support this piece of legislation. And as being the first Afro-Latino elected to the Commonwealth of Massachusetts, because I do emphasize that, because yes, I am the first Puerto Rican, first Latino from Hampden County to sit in the Senate seat. We have to continuously understand that some of us can be the first, but we're never going to be the last. And honestly, individuals that need that help and this piece of legislation that can conquer that, this Clean Slate initiative. I just want to thank Sheena again for all the work that you do, Jessica, and your organization for just having this briefing and having me be a part of it and being a representation. I know my other colleagues, if they could, they would be here with me. I'm truly stand amongst champions and stand on the shoulders of a lot of advocates out there that are doing the good work when it comes to criminal justice reform. So thank you so much. And I know a good friend of mine is going to come up and speak a little bit more on that. So I want to give thanks to be able to share the table with a like-minded individual like myself, Mr. Jay Ash. Thank you so much. It's good to see you, brother.
Can I
It's
just
great.
say, oh, I'm sorry. I just want to say, I want to also, again, thank Senator Gomez. I didn't know your own personal story, that you had one similar to mine, but it's so important for folks to hear the story. And it's not about living in the past, it's about showing people what is possible. So for like other directly impacted people across the country, I appreciate you
I
sharing your
appreciate you.
story among your colleagues, among the community, and however we can support you in amplifying, the work that
Yeah.
you're doing in your story. We're here to support you.
Even on the legislature, the record just got cleaned. Let me tell you, that is the truth and inevitable. And I never hide that. You know what? It's been a roller coaster ride since I was 17 years old, with the challenges of trying to be a young man and trying to thrive and figure the things out. But that's why pieces of legislation such like this speak to me. But I know it speaks to the constituents and that I serve here in the Hampden district. So thank you for the shout out. I appreciate it.
Well, I'll jump in. Thank you, Senator, for the introduction. It's an honor to be part of this panel. The nice thing about being last is you get to listen to what everyone else has to say. And I can summarize my presentation very easily, everything that they said. All right, so Jessica, you talked about public health imperative. Absolutely. Social determinants. The evidence is overwhelming about the cause that we're engaged in. Dr. Mead, there but for the grace of God, go any of us. I grew up on the mean streets of Chelsea. I'm not proud of everything I did as a young person. Never got caught though. I can only imagine what happens when you get caught and how difficult it is. And yet, all of us, a lot of us find our way, and we find our way to good, and we make up for those things that we did in the past, and we try to make life easier for others, and that's what we're all about here today. Senator Gomez, bringing equity to a justice system that hasn't allowed a lot of equity before is exactly what we should all be interested in. So this is the right time on the right issue for so many of the right people. So my name is Jay Ash. I'm the CEO of the Massachusetts Competitive Partnership. We're a business association of 20 CEOs of the largest headquartered companies in Massachusetts. I'm sitting in our boardroom here in Boston. Mass Mutual and Bay State Health are members of our organization. So 413 is well represented with two of its three largest employers. Because you all did a great job talking about the reason why we're here today and the issues that we're trying to overcome, I'm going to start with not relitigating that, but instead telling a story. I just came from the Greater Boston Chamber of Commerce event here in Boston, 500 people, where Speaker Ron Mariano, a champion himself of vulnerable people, spoke. And after the meeting was over, we were milling around, and I ran into one of my business leaders, and he said, "Tell me what else you're doing today." And I said, "Well, I'm about to go on a webinar to talk about Clean Slate." He said, "Tell me more about Clean Slate." And I did. And he said, "I know a guy." And I thought to myself, don't we all know a guy? Don't we all know a gal? Don't we have a friend, a neighbor, or a relative who's in a situation? And he grabbed my hand. He said, "Thank you for what you're doing today, and let everyone else know that I believe in the cause as well." This is the right thing to do. It's very simple. I've been asked to talk about why businesses are interested in this. It's the right thing to do. Clean Slate it's obvious about expanding the talent pool for employers. Anyone that's been paying attention to what's going on in the economy, we know that there are labor shortages abounding. Having more people ready to work is really important. But it's not just about more people ready to work. It's about having more people who are motivated to work. And we know that so many people who get out, who have been justice impacted and get out and want to get on with their lives are amongst the most motivated amongst us to make good for themselves, for their families, and for society. And so for employers around the state who say that they're looking for people who are committed to work, this is a great way of getting a larger labor pool available. But it's not the only thing that matters for the business community. So promoting economic mobility is an important part of what lots of us have championed. My first job was a delivery boy, and now I'm a CEO of a business association. Economic mobility, grew up on welfare, single parent family, mean streets of Chelsea, and yet here I am as a CEO of a major business association. We need to promote economic mobility and help everybody along that path to their own personal mobility success. We, the business community, are very much interested in supporting fair employment practices and being able to give people the opportunities that accrue as a result of that. Enhancing workforce diversity is an important part, and the workforce experience. People from all walks of life coming under one roof and working together on a common cause is a good thing. And there's lots that people who've been justice impacted can bring to the table. Looking forward to being able to fully take advantage of that. I touched upon it a little bit. Senator Gomez and I have talked a lot about it. Senator, thank you for continuing to be who you are, not only in Springfield and in your district, but up at the State House as a powerful representative of what's good amongst us all. We need to do more to reduce and eliminate biases that are out there, and those biases happen everywhere. I'm wearing an anti-Semitism pin today. I'm not Jewish. I'm wearing an anti-Semitism pin today because we all have to experience. We all have to remember that we haven't walked in each other's footsteps, but we have to find ways of sharing the experience and helping people overcome it. And removing those biases is really important to the business community. And, lastly, I'd say that contributing positively to social change is a major imperative for the business community, especially in Massachusetts, especially for employers like MassMutual and Bay State Health. So, societal well-being is better served by employing people and allowing those people to earn a living and support themselves and their families and be positive contributors to community. The economy is important, but community is as important as well. And there's a thing that you all have out in the greater Springfield area. It's a great quality of life and a togetherness that you all experience. And having more people that can contribute to that is really important. We shouldn't be in a place where we're delaying or worse, taking away the legal opportunity for people to experience that. And we all know that the interesting thing about Clean Slate, we all know, is that people are eligible to get their records sealed, and yet the process that in some cases intimidated or worse to them is the process that they then have to go through in order to clean their record and move on with life. That's not fair, especially when we can automate it. Senator, as you said, we can automate it and make it eligible for everybody. We need to extend together a community where we're overcoming despair and we are supporting each other so that, Dr. Mead, as you said, we're living the best versions of ourselves and people can live the best versions of themselves. So clearing a record is certainly about creating that opportunity for the best versions of ourselves to emerge. It's clearing a record's about boosting earning potential and making individuals better family members and better family members, stronger members of the community. And certainly from the business community's perspective, it's about making for a more vibrant economy for everyone that's in our that lives in our Commonwealth. So, to echo the thoughts of the business leader I just recently talked to, it's not just about dollars and cents. It's the right thing to do. And so I'm encouraged by the Adam Gomez's of the world. I'm encouraged by the Mary Grants of the world from Worcester. I'm encouraged by the Andy Vargas's of the world from Haverhill and so many others up in the legislature, Cindy Friedman and others that have come together. Carlos Gonzalez, thank you for your efforts that are coming together and saying, this is the time. And Sheena, I want to tell you why this is the time. You mentioned us becoming the 13th. We here in Massachusetts are about to launch the 250th celebration of the founding of our great country. We were one of the original 13 colonists that signed on. Now, we weren't 13, Sheena, we were number 6 at the time. But being the 13th would be a great way to honor what this country is supposed to stand for individuals and supposed to stand for community. So I hope that all of us on this call will find the ability to continue to fight for those who need a voice, continue to work with enlightened legislators like Senator Gomez, continue to champion our communities in a way that allows for everyone in our communities to experience the best versions of themselves. I'm glad to be part of this and know that I speak on behalf of 20 very big CEOs who say, this is the time to do the right thing. Let's help the Massachusetts legislature get there. Thanks, everyone.
Thanks so much, Jay. That was great. I know the Clean Slate Massachusetts Coalition could do something with that campaign idea. I love it. So thank you, everyone. I'm going to start with Dr. Mead, and you did touch on this a little bit, and you talked about Massachusetts as the 13th, but can you talk maybe about some other states, or who are you feeling really inspired? And if it's us, that's great, but are there other states that you could speak to just for a little inspiration here?
Yeah, well, we have a few states working on clean slate legislation right now. I will say, let me give a shout out that Missouri yesterday, a bill passed through the House. And so excited about that. It unanimously went through committee. And we're fingers crossed, hoping, praying, and doing all the things we can to the universe about it getting through the Senate. I hope that it will follow the House. But I will say that Missouri has been kind of on a similar track as Massachusetts, incorporating a public health piece around it, which is really great, and having a bipartisan appeal. So I'm hopeful there. We've been hearing a lot about Illinois. Illinois, we're actually celebrating our 5th-year anniversary as Clean Slate. We've done a lot in 5 years as an organization and as a movement across the country. But our champion, our sponsor there, Gian Booth, just did a radio piece and hoping that also, like Jay was just saying, the business community has said, look, this is a workforce issue. We want to get people back to work. And they're supposed to be doing some introduction of that bill. And I'm hoping that it'll move. But there's like, folks having conversations. There's an Ohio where there's a coalition that is building. There's called the Grow Act in Ohio. And then today we heard that Minnesota is looking to be able to implementation, I think, supposed to start by the end of the month, start clearing the record. So there is momentum happening across the country in many states. And really just looking forward to, it really sits different when you see many states, different walks of life, different people, different approaches, different strategies, but all coming back to clean slate laws and helping people. And it's just, in a month of Second Chance Month, when we're really saying, look, it's people over politics, being able to see a lot of the movement happening across the country is really rewarding for folks.
All right, thank you. That is very helpful. And we in Massachusetts are extremely competitive people. So if Missouri can do it, we can do it. Thank you for that. Senator Gomez, we're hearing that legislators aren't signing on to as many bills these days. How important is it for us to get co-sponsors? How do you decide what to co-sponsor, and any advice for the advocates right now?
Well, usually at times, I would say the times are a little, I would say, different because a lot of our minds are figuring out what's going on federally. To be totally transparent, I don't think that it's a lack of they don't want to. As a moment at the moment, committees have just started moving in the last week or two. I just had my first cannabis hearing yesterday, to be transparent, and I think that because there's so much, I would say. Fogginess, I would say, and uncertainty coming from the federal level, like healthcare and education, some of the cuts that we've been enduring as of late. I think right now what I do is I tell individuals, specifically, out in the state house, or individuals that come to see me, is because most of the folks that I talk to are from all over the Commonwealth, and I always tend to tell folks it's important for you, and I always give even a group of kids that come to see me, or young adults, or individuals, regardless of what the crowd is, email your representative or stop by if you're in the house, and introduce yourself. Ask them to co-sponsor. Us as legislators will throw out an email asking for co-sponsors. And the way that I kind of do it is in packages of criminal justice reform, or my healthcare package, or if it's my housing package. And, through the caucuses and through the arts, because there's different caucuses. And now the Black and Latino caucus is actually going through our priorities, and we're going to actually submit some of our priorities. I can't really give too much information on what those priorities look like, but it's looking very promising for this piece of legislation, quote unquote. Okay, I gave you a little mic drop there, but once that comes out, they want to see kind of what the Black and Latino caucus is kind of doing. And I know that we have 3 members on the Clean Slate bills, like Representative Fluka Reed and also Andy Vargas. And I think, from what I understand, this piece of legislation is gaining traction. Maybe as of right now, there's not as many co-sponsors on it, but I know that advocates and all of us are going to be throwing in a lot of work in this session to obtain a lot of those co-sponsorships, which I know we have. Since the rules have changed a little bit, we're trying to get done a little bit earlier than before Joint Rule 10. We have moved that date back into this year, instead of going into the until next year, until February. So what I tell folks, and folks that are on, please email your senators and states, or any senator or representative that you have a relationship with. And if you're part of other organizations that have different coalitions as well, that have individuals that sit on your boards, and this is important for you, this piece of legislation, please have them reach out, because we need to build these bridges. We need to bridge the gap. We need to be bridge builders, especially with this piece of legislation, to be able to contact as many people as we can. And, myself and all of the other legislatures and all of us, we're just a few of the many that know that this is going to be a very revolutionary piece of legislation once it's passed.
Great. Thank you so much. And we are so glad to have you up there in Beacon Hill. Jay, last quick question for you, then Andrea is going to take over. But my thought is it's not often that we have economic development and public health on the same side of things. I know public health can be seen as, a regulator and coming down too hard on economic development. But as you so beautifully stated before, this seems like an obvious one. So I would love to just get your take right now for this audience. How can we leverage what you were sharing about this seems to be the right moment and get more economic development players involved with regard to advocacy? Any thoughts on
Jessica, I appreciate the spirit of that. I'm not sure that I fully agree with it. So I'll do the polite pushback. But one of the things that Governor Baker did for me. So as Andrea introduced, I was a member of Governor Baker's cabinet. Governor Baker, Republican. I'm a Democrat, lifelong Democrat. One of the things that being in a Republican administration did for me was it caused me to open up my notions, my preconceived notions about everybody. In this time where community seems to be under assault, it's more important than ever that we all look at the relationships that we have, whether they're good or not, and try to find ways of coming together for the best of each other and the best of the community. And so, I would suggest that anytime any public health advocate is in the presence of a business leader, just go over and say hello and talk about what you're all working on, because you know what? A lot of those business leaders are really interested in those topics for themselves, for their families, for their employees, and vice versa. The same thing that I encourage business leaders to do all the time is to find ways to engage with a public health community. Look, we all believe in like 95% of the same things here in Massachusetts. We're lucky to be in Massachusetts. Let's acknowledge that, right? We all believe in 95% of the same things. Sometimes we get hung up in that last 5%. Somebody needs to worry about that 5%, but we don't need to worry about the 5% in every call and every issue that we're working on. So there's a lot of commonality of interest and purpose out there. And so I would encourage everybody to not think of the business as a bad capitalists and not think of public health people of whatever. I can't even come up with a negative thing, Jessica, whatever the business community might think of public health advocates. And instead think of us as residents of a community, as stakeholders of a community, and find those things that we can work together on and then build relationships so that tough 5% we can better have a conversation about.
I love that. I'll never say that again, Jay. Thank you so much. All right. Thank you all so much. I'm going to hand it over to Andrea because we do have some questions in the chat. Thank you, everyone.
Yeah. Thanks, Jessica. And thank you, Jay, Senator Gomez, Dr. Mead. Thank you so much. We do have some questions here from folks that came in, and I'm going to click the answer live to see if Richard Johnson, if you would like to come on and speak and ask your question. Let's see. I may not have done this properly, so I'm going to read his question. Oh, there he is. All right. Hello, Richard.
Hi, good afternoon, folks. And let me begin by saying thank you so much for the forum and for your commitment and dedication on this issue. My question is kind of broad, and it really goes to fundamental issues around folks who have CORIs and what priorities are set as a result of access and lack thereof as a result of having a CORI. And my question goes to the issue around how CORI impacts housing. A lot of the data and statistics that were quoted were very negative in terms of life expectancy and employment options and opportunities. But one that permeates through it all is housing and access to adequate housing. And I'm thinking about single occupancy as it relates to folks who are aging with CORI and are blocked from a lot of the things that were mentioned as a result of CORI. And I'm wondering whether or not you guys have had discussions with colleagues and others around mitigating some of the challenges and barriers and thresholds that block people from having housing and stabilization as a result of, because my perspective is when you're not worrying about where you're going to rest your head, you're able to focus on other issues that will positively impact the quality of life that you lead. So I want to know if there are some considerations around single occupancy in particular, because many folks are single and without housing and that kind of thing. So wondering if anybody has any contributions around that area as it relates specifically to Clean Slate efforts around the country and in Massachusetts specifically.
Well, I think that's a legislative question. So truth and what's evident, Brother Richard, is that that's one of the premier issues when it comes to the public health aspect of this piece of legislation is using myself as a one that had to suffer with the housing situation, dealing with my housing insecurity, even with individuals that are elevated in age that have these old records that kind of follow them. Um, Introducing a clean slate that would entertain the fact that some of these individuals that another piece of policy that has nothing to do with what we're talking about, obviously, with the rate stabilization situations that are going on with the housing costs, individuals that are, further along in their life are living on fixed income, if applicable, right? And if they subject to the point that can they afford where they live, then at the same time, do they qualify to live there? Because some subsidies, specifically HUD, prohibit individuals with criminal backgrounds in living some of these situations, regardless if it was a single occupancy or it was if they were in a family and because of, let's say, if it was like for a low level drug crime, myself wouldn't qualify to live in like a Springfield housing situation. Now that if we're able to remediate that with this clean slate piece of legislation, I think that would open the doors for a lot of individuals to qualify. Secondly, obviously that doesn't help the situation that we're like in I hate to keep on calling a housing crisis. It feels like a housing Armageddon, where individuals, regardless, there's a lack of, and I know we're going to be coming up a year that we've passed our housing bond piece of legislation, and we still have not put a shovel in the dirt yet, which I'm not necessarily trying to be critical of the administration. That's something that we have to tackle in itself, because even if Clean Slate was to be passed yesterday, we're still going to be faced with what's in front of us, specifically here in Western Massachusetts or around the Commonwealth, of the lack of 200,000 plus units that we do need. So, granted, I think that, that's one of the topics, one of the strong topics, I believe, that with Clean Slate is to make sure individuals that can qualify, that are coming out of incarceration, specifically our returning citizens, that you've heard the statistics that were given by Sheena, that that's one of the biggest narratives, and where we call cut in the last budget during this current administration, is that returning citizens, when it comes to the funding for it, which I've been fighting in the budget for the last two sessions to try to close that gap, is to find money for individuals that are returning from incarceration to find stable housing. So, granted, noted, and I appreciate that question, but that's something that has like a holistic kind of different pieces to it, to make sure individuals you're questioning on behalf of find that type of housing, and us as a legislature, and then finding those developers within our city that are going to be developing these types of housing for individuals that live and that need single units. Because most of the, on Worthington Street, and a lot of individuals looking for housing that are elderly are usually single, like you had stated.
Hey, Senator, I'm wondering, Andrea, if I could jump in as the former Secretary of Housing and Economic Development. I have a strong opinion about this. State's doing a lot of the right things. And Senator, congratulations, a record housing bond bill. Congratulations to the Hilly administration for doing that as well. Oftentimes, housing at all levels that we need gets stopped at the local level. It's important that we all continue to engage on the local level in the development process and make sure that we speak up for people who are in need, people who are in need of housing, people who are in need of supportive housing, people who are in need of affordable housing, people who are in need of housing that's affordable. I consider that to be workforce housing. It's important that we speak up at our planning boards, at our zoning boards. It's important that we speak with our city councils. Adam and I first met each other when he was a city councilor, and he got it then. So important to say, hey, state government, what can you do? Hey, federal government, what can you do? It's also important to be heard on the local level about the need for more production.
Agreed.
Hope that was helpful, Richard. I thank you so much for asking that question. And my colleague Kelly also suggested that Massachusetts within the housing bond bill that was passed last session reminded me that the accessory dwelling unit legislation was passed, meaning like to be able to
ADUs,
build
yep.
the in-law apartments or the granny flat, so to speak, which again, you still have to have the money to be able to do it, but at least now every town and city in Massachusetts can do it, so that a family can make a single unit or a small unit for a loved one who may have trouble getting housing elsewhere. But of course, doesn't solve the problem when we're over 200,000 units short. Yeah, so we're coming up on time, but I have another question. I was gonna, if Bob Mara, if you would like to share, um, if you're able to come off, if we're able to get Bob Mara to speak, there he is. Excellent. Thank you, Bob.
Hi, yeah, this is a question for Jay or actually Jessica. I've been doing healthcare for the last 50 years in Boston's teaching hospitals, including with Jessica. Hi, Jessica, my awesome colleague at Cambridge Health Alliance. I also been the last 7 years visiting Baltimore regularly, and particularly Johns Hopkins. And the former CEO of Johns Hopkins Healthcare, Ron Peterson, is now the chairman of the board of a reentry organization that's probably the most amazing in the country, Turnaround Tuesday. And for the last 10 years, this is in their current 10-year report, they've hired about 2,000 people from the city of Baltimore to work in the hospitals down there. And some of us are trying to get Ron, up here to talk to the CEOs up here, because nothing happened in Baltimore until the CEO level got involved. And they got an award from President Obama for doing what they're doing. Just wonder if, we can somehow get this guy up here. Sorry.
Oh, Jay, yeah, there you go.
No, I
Sorry.
will, Adam, I will note, I'm sorry, Andrea, I will note, thank you, Bob, and I responded in text as well. I think we're lucky to have the health system providers we do. As city manager at Chelsea, Mass General Brigham was my first call, my medium call, and my last call anytime I had an issue, and they helped me get over lots of things like the drug abuse to be a social to be a mental health issue, and to stop looking at things from a policing perspective and start looking at things from a counseling perspective. So I find them to be the biggest advocates for lots of the things that we care about in the public health space. Bob, you were kind enough to throw in the chat the report from Baltimore. I've downloaded it. So I'll take a look at it, and certainly happy. I find Ann Klebanski, Mass General Brigham, Peter Banco, new to you guys out in Springfield, but I've engaged him in discussion. He's very interested in these things. So Bob, I'll look at what you suggested in Baltimore, and we'll continue the conversation.
Thank you. And we're coming up on the last few minutes, and Sheena, Senator Gomez, Jay, Jessica, do you have any questions for each other, or any advice for each other, or invitations for each other? Challenges?
Yes, with Senator Gomez, I'm just still sitting here just really with the appreciation of you sharing your story in the way that you champion this issue. And I just really, challenge you to talk to other legislators and representatives across the country when you're in spaces, to be able to let them know, like, this is common sense policy. This is a policy that you could work with people across the aisle with, and why it's good for our economy. It lands different when it comes from another representative. And I know, as the community, we're challenged to reach out to our members as constituents, but there's something about when a legislator hears from another legislator and they're seeing success in their state and they get to hear from you. So I would ask again just to share and just let folks know, like, as there are states that are struggling to find legislation that they could get passed or work across the aisle on, this is something, again, that you could tell folks they could champion. So that's just giving that appreciation also to Jay with the businesses. The business community is so important and so vital. And for many coalitions, just in other work. I used to be an organizer. You don't always go to the business community as your first ally. So this is like new, you know, and I take a real pride in seeing across the country where business and labor and grassroots, grass top health is all coming together to champion the issue of clean slate and continue to just like lift it up and make that connection for people, or why this is good for our workforce economy and our communities. So again, it's more to give praise and give challenge to continue to do the work that folks are already doing, but just any opportunity to talk about it, because 1 in 3 people is so real. I don't care. Anytime I'm on an airplane, and I'm telling you, I should get a captain's license soon, a pilot license, because I'm on a plane so much. But anytime I'm on a plane and someone decides to talk to me, it doesn't matter where they start the conversation about, where they're at with criminal justice reform or clean slates. Before the end of that flight, they're telling me a story about their cousin, their brother, their colleague, their college mate, and it's just close to home with folks. And I believe that we could bring people along to change hearts and minds, and I look forward to doing it with you all.
I know we're coming to time, but I just want to say that all of you on the call are making a difference. Senator Gomez would tell you that, others would tell you that. It's important that we, the business community, especially leaders of the business community, speak up, but it's also important that you're heard. And so, continue to share your voice, continue to share your story, continue to share your time, and together we'll make sure that this happens.
From your words to Beacon Hill. And thank you all again so much. And I just put in the chat, there's a bunch of links in there that we'd really love it. If you want to learn more, if you want to get updates or action alerts, please join the Clean Slate Mass Coalition. And we are grateful for you all to be here today. And thank you to all the presenters. Have a good afternoon.